you can see from this graph, weight loss will vary depending on the weight loss procedure that you have obtained. If you look at the graph, the gastric bypass is the procedure that gives you the most excess weight loss in the next 5 years, followed by the sleeve gastrectomy and the gastric band. However, at about the 5-year mark, all of the procedures will equalize, and most patients will have lost the same amount of weight at 5-year mark. So therefore, a gastric band patient might take longer, 3 to 5 years, but at 5 years, they will have lost the same amount of weight as a sleeve gastrectomy patient or a gastric bypass patient. I need to add, however, that in my practice, I have noticed that when I do a sleeve gastrectomy on a patient with a BMI between 40 and 45, I notice that this patient loses as much weight as a gastric bypass patient of similar BMI. In preparation for the surgery, these are the steps that are normally taken. First of all, there are certain medications that need to be stopped before the surgery. For example, if you have type 2 diabetes and you take metformin, normally we recommend that you stop this medicine at least 24 hours before your procedure. Things like aspirin, you need to stop about a week before the surgery. Coumadin, which is a blood thinner, and Plavix as well, we need to be stopped at least a week before the surgery. And of course, we do certain labs to make sure that your levels are within safe levels for the procedure. Other medicines like high blood pressure medications, for example, you can take with a sip of water the morning of surgery. The day before the surgery, normally we instruct the patient not to eat or drink anything after midnight. But as I said, before, if you take a high blood pressure medicine and your cholesterol medicine, you can take that the morning of surgery with a little bit of water. Before the patients come for the day of surgery, other things have happened. One of the things that have happened is your pre-op lab work. And during this lab work, we measure certain things like we do certain basic studies, check for your electrolytes, things like potassium, sodium. We check for your glucose. We check for your hemoglobin, make sure there's no anemia, make sure there's no ongoing infections. These labs are normally are not just for weight loss procedures, but are generally labs that are ordered for other surgical procedures as well. After the surgery, let's say on day 1 of your surgery, you will be in the bariatric floor of our hospital. First, I encourage my patients to walk. Walk, walk, walk. This is very important, and this is done to prevent blood clots from forming in your legs, which can go up to your lungs and cause a pulmonary embolism. And walking is the best prevention that you can use for this. In addition to walking, we give you certain medicines like Lovenox that will prevent blood clots from forming as well. On day 1, you will obtain a special x-ray called an upper GI, especially if you had a gastric bypass or if you had a sleeve gastrectomy. During the upper GI, we check for things like leaks, make sure that everything in the surgery looks the way it should. The upper GI is normal, then we're going to start you on a clear liquid diet. The clear liquid diet is what we refer to as phase 1 of your post-op or your post-surgical diet. This one is normally achieved in the hospital, and it just consists of clear liquids, anything that you can see through. So things like low sugar or no sugar apple juice, popsicles. We'll also incorporate jellos or low sugar or jellos and broth. After you go through the clear liquid diet, on day 2, up to 90% of the patients are ready to go home. When you go home, we ask you to resume your home medicine, especially your blood pressure medicines. I normally tell you not to take your type 2 diabetic medications until you measure your sugars and make sure that they are high, because believe it or not, after sleeve gastrectomy or a gastric bypass, days after the procedure, your sugars may be running normal. So we ask you to measure it first before you take your your diabetic medicines. Because we send you home on Lovenox, which is a blood thinner that prevents blood clots, we normally tell you not to take any of your aspirin-like products, Plavix, or Coumadin until we take you off your Lovenox. When you go home from the hospital, you are discharged on the phase 2 diet, which is essentially a full liquid diet. It's still liquid, but it has more substance to it. So things like protein drinks, for example, would be considered full liquids. Yogurt without any fruit pieces in them as well. In addition, we give you a long list of the things that you should do and the things you should not do. And in this list are things like avoiding carbonated drinks that are high in sugar, especially after a gastric bypass or a sleeve gastrectomy. In our program, we also have a nutritionist that works very close with our patients. She will help you go through different phases after your surgery, your dieting phases, and she will help you discern the things that you should be on and the things that you should avoid. Very important that I mentioned to you also that we have a support meeting that is run by our nutritionist, and this support meeting takes place once a month. And during the support meeting, we normally have a topic that we discuss. This topic usually has to do with nutrition. We see where you are in your weight loss process and the things that you should be eating and the things that you should be avoiding. And we highly encourage our patients after surgery to start coming to the support meetings where they can get further information in their weight loss journey. One of the most important things that you will learn at our support groups is that weight loss procedure is a tool, and it's a tool that you're going to use throughout your life to change your lifestyle or help you in your lifestyle changes. When used correctly, this weight loss tool in combination with eating healthy and exercise can achieve profound initial weight loss. And if you continue with those changes, your weight loss will be indefinitely. Some of the things that we will discuss at our support groups will be things like what should you be eating, what are proteins, what are the different proteins amounts found in different types of foods that we normally eat, the things to avoid, when to exercise, how much to exercise, which exercises are important, the different changes that we go through psychologically as you're losing weight. As you're losing weight, you're becoming a different person. You're doing things that you were not doing before, or things that you did many years ago when you were thinner. And this can cause some changes in your, not only your lifestyle, but your relationships. And we discuss all these different aspects of the weight loss process in our support groups. But the support groups are open not only to patients that have surgery, but also for those that are thinking of having surgery. And I highly encourage my new patients to come to our support groups so they can meet patients that had their surgery, see the things that they went through, and see what kind of results they got as a result of the procedure that they chose to have. One of the most common topics or questions that patients have is pregnancy after weight loss surgery. Where first of all, especially my patients that suffer from polycystic ovarian disease and therefore have been struggling to get pregnant, I tell them, if you're getting a procedure where things can happen very quickly, like a sleeve gastrectomy or a gastric bypass or a gastric band, as you're losing weight, it actually becomes easier for you to become pregnant. So therefore, in these patients that have polycystic ovarian disease, I tell them that you have to find a good method of pregnancy prevention for at least 1 year or until your weight loss has stabilized. This is very important because, number one, you do not want to get pregnant during the first year of a weight loss procedure. Of course, you put yourself at risk and you put the fetus at risk as well. Also, once you get pregnant, usually weight loss stops. And once you give birth, it's very difficult to go back bring your body back to the point where you were losing weight. I mean, your body have readjusted by that point in time, and weight loss forward after giving birth will be just as hard as anybody else, requiring exercise and dieting as well. In other words, the weight loss procedure have lost its effectiveness after a pregnancy. After a gastric band, the gastric band is probably the easiest of the patients to take care of. If one of my gastric band patients gets pregnant the first year or during the weight loss period, all I need to do is remove the fluid from the band, and they can go back to eating normal like everyone else to maintain their pregnancy. Sleeve gastrectomy patients and gastric bypass patients, however, we recommend that these patients do not get pregnant the first year to a year and a half after their procedures. Again, it's for safety reasons and for weight loss reasons as well. Once you get pregnant, weight loss will stop in most cases. And once you give birth, to go back and continue losing weight or start where you left off will be very difficult.